Hi everyone, this is Mr. Neil Wright, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched in early December 2022. If you are interested in the WAXscope, please do email info@clearwax.co.uk. So we have a patient who presented with bilateral, fully occluding, really dense and occluding impacted earwax. And you may have seen the initial examination video was taken with our iClearScope endoscope, which provides a wide field of view. And the patient has got quite a slit, so a narrow ear canal, and it's quite a few cilia hairs just at the entrance. And I'm just commencing with their left ear. I started with the Zollner suction probe, but it was very apparent straight away that microsuction wasn't going to remove this plug of wax, or in order to perform microsuction, I would have to really persevere and put loads of drops in. So I decided to revert to using manual instrumentation, such as Jobson, Horne and ear hook. And at the moment I'm using an ear hook here. But the wax was although it was quite dense, it was quite soft as well. So I think I'm going to use a Jobson Horne in a moment. There we are. Which has greater surface area, and as opposed to the hook, where the hook's more likely to dissect through the soft core of the wax. So instead of extracting it, it's almost cutting it into little pieces, which does have its advantages, especially if you're using an ear hook in conjunction with microsuction. But sometimes with a Jobson Horne, it just gives you, as I said, a larger surface area, and instead of dissecting through the wax plug, it kind of does facilitate its actual extraction and movement out of the ear. So it's quite a substantial amount. If you've seen the thumbnail, you'll see there's a lot of wax here, and it was extending all the way to the patient's eardrum. The consistency, the best way to describe, as I said, it was dense and also quite sticky and stodgy and soft in its course. It's almost like a fudge consistency. It's the best analogy I can give. And slowly but surely just bring this forwards. It was quite matted, so the hairs that were matted against the wax, you probably see a few of them there. In a way, they were trying to stop the wax plug from moving out. It was like a tug of war against the hairs. So slowly but surely, you can see I'm going to the roof, just trying to get over the back, and then slowly bringing this Jobson Horne forwards. You do got to be careful, because we got to ensure that the Jobson Horne, it's when we're extracting it out of the ear, it's not forcefully being embedded against the canal wall. So if you embed the Jobson Horne too deep into the wax, or too much to the sides, as you're bringing it out, you're going to get contact with the canal wall, and it'll cause injury and trauma. So just got to be careful, and that's where it's really important as a clinical ear care specialist that you know your ear anatomy, and you know your curvature and depth, etc. So we are slowly but surely bringing this out. I've got tons out already, believe it or not. And I said, if you watch till the end, you'll see a still image. So this is another huge chunk that I'm just bringing forwards. So the reason for the WAXscope is we initially developed the iClearScope endoscope back in 2015, and in terms of the optics of an endoscope, there's nothing really that can compete with an endoscope. And our iClearScope, it was custom made for the intended use of earwax removal. So with an endoscope, it provides this wide panoramic field of view, which is great. However, that also has its negative. It's a trade-off. So if you have too much of a wide field of view, then the magnification of the eardrum is reduced. And conversely, if you have too much magnification of the eardrum, the field of view is reduced. So we worked really hard to get the optimal ratio between the field of view and magnification. So we've got the endoscopic view where you can see all around you. But also, importantly, we're able to see the eardrum if there's any wax that's deep in the ear. But with an endoscope, it does require a high skill level to use. It's similar to an operating ENT microscope, which is another visualization method of viewing earwax. It can be quite it's quite a skillful procedure, especially with the endoscope. It's because with the endoscope, you're not using a speculum to straighten and widen the ear canal. So, unfortunately, our ears, well, unfortunately for clinical ear care specialists, but fortunately for us as humans, our ears are not straight cylindrical tubes. If it were, then the eardrum would be unprotected. It would be exposed to any foreign body that may enter the ear. So our ear has evolved. So we have got, it's more like a sigmoid shape, so an S bend, and the bends in the ear protect the eardrum. So if you do have a twig, for example, that's entered in the ear, it has to maneuver itself around the two bends before it approaches the eardrum and perforates it. So an endoscope doesn't use a speculum to straighten the ear. Instead, the specialist has to use the endoscope itself to stretch and widen the ear canal. And the endoscope's held in the non-dominant hand. So in my case, I'm using it in my left hand at the moment, and I've got the instrument in my right hand. So I'll come back to that in a moment. So just cleared the ear. You can see it's really, really hairy near the entrance, but we're just using the speculum to push that away. There's the view of the eardrum, fantastic view. Can even see the chorda tympani there. You can see all the blood vessels supplying the hammer bone. So that's the left ear done. I'm just going to do the right. The ear was slightly more narrower, so you can see I'm just stretching it wide, a bit wider with the speculum that we're using, which is a 4.25 millimeter. So yeah, an endoscope does require a high skill level, and over the years it's become apparent that a lot of people do really, really struggle when they attend the training courses. So it's always been something that I've wanted to do is develop a secondary device or an alternative device to the iClearScope where there's a speculum attached. So it's taken a while. There's loads of obstacles we've had to overcome, but I'm glad to say we have. And so in terms of the WAXscope, which is what you're seeing right now, it doesn't have the same field of view, and that's because you've got a speculum. So for that reason, the field of view is somewhat negated. So what we're focusing on with the WAXscope is the zoom, the magnification and clarity. And the view that you're seeing now is very, very similar, very akin to an ENT operating microscope. So at least when removing earwax. So when an ENT doctor, for example, uses an ENT microscope, this is the kind of view that they receive. So I've just removed a plug of wax, just a bit of keratin at the entrance. I'm just going to remove this with a Jobson Horne. And so the WAXscope for me is the next best alternative to the iClearScope endoscope if you're not able to use the endoscope. And a lot of people, they're not able to. And just because I said it requires a lot more bilateral integration. So integration between your left and right hand, so it needs to be a lot more ambidextrous. So with this, you're using this speculum to straighten the ear, not the endoscope, so it just makes it more user-friendly. Again, the patient's got a lot of hairs, but even despite that, we can see the eardrum, got a lovely view there. So the blood vessels are not dilated as much as it was in the left ear, and that I suspect because there was less wax in this ear. The wax in the left ear was impacted against the eardrum. You can see all that wax. There's a tremendous amount of wax, and the majority was from the patient's left ear. And you've got the instruments, the Jobson Horne at the top, the earhook at the bottom, and a pencil there to the left to give you some perspective on the amount of wax removed. Well, I hope you enjoyed that video, guys, and if you are interested in the WAXscope, please do email info@clearwax.co.uk.